Hi, I'm Shannon Crutchfield, and I'm with Liberty University in the communications class, COMS 101, presenting coronary artery disease. And this is my audience.
Push it, stop it.
First is Jamie, Doak, and Nancy. Coronary artery disease is a narrowing of the blood vessels that supply blood and oxygen to the heart. It is usually caused by atherosclerosis, a fatty material that forms a plaque buildup on the walls of arteries. As the coronary arteries narrow, blood flow to the heart can slow down or stop. This can cause chest pain, shortness of breath, heart attack, and other symptoms. It is the leading cause of death in the United States for men and women. Risk factors include men in their 40s. However, as women get older, especially after menopause, their risk increases to almost equal that of a man's risk. Heredity, diabetes, high blood pressure, abnormal cholesterol levels. Your bad cholesterol, LDL, should be as low as possible, and your good cholesterol, HDL, should be as high as possible. Smokers and other risk factors include alcohol abuse, not getting enough exercise, and having excessive amounts of stress. Individuals must be aware of the symptoms of coronary artery disease. Symptoms may be very noticeable, but sometimes you have the disease and not have any symptoms. Chest pain or discomfort, also known as angina, is the most common symptom. This occurs when your heart is not getting enough blood or oxygen. It may feel heavy or like someone is squeezing your heart. It can be felt under your breastbone, sternum, and also in your neck, arms, stomach, or upper back. The pain usually occurs with activity or motion and goes away with rest or medication. Other symptoms include shortness of breath and fatigue with exertion. Women and people with diabetes are more likely to have symptoms other than chest pain, such as fatigue, shortness of breath, and weakness. Diagnostic or therapeutic tests are often performed to rule out or rule in the diagnosis of coronary artery disease. Individuals should be educated on these tests if they are to undergo these procedures. These tests include coronary angiography, arteriography, CT angiography, echocardiogram, electrocardiogram, exercise stress test, magnetic resonance angiography, and nuclear scan. Many medications are used in the treatment and prevention of coronary artery disease, including ACE inhibitors, which lower blood pressure and protect your heart and kidneys, aspirin, with or without Plavix or Effient, which help prevent blood clots from forming in your arteries and reduce your risk of having a heart attack. Beta blockers, which lower your heart rate, blood pressure, and oxygen use by the heart. Calcium channel blockers, which relax arteries, lower blood pressure, and reduce strain on the heart. Diuretics, which lower your blood pressure. Nitrates, which stop chest pain and improve blood supply to the heart. Statins, which lower your cholesterol. You should never abruptly stop taking any of these medications. Always consult your physician. Stopping these medications can make your angina worse or cause a heart attack. Procedures and surgeries used to treat coronary artery disease. Angioplasty and stent placement, coronary artery bypass surgery, minimally invasive heart surgery. Tips for preventing coronary artery disease or lowering your risk of the disease include: avoid or reduce stress as best as you can. Don't smoke or drink alcohol. Eat well-balanced meals that are low in fat and cholesterol and include several daily servings of fruits and vegetables. Get regular exercise and manage your weight. Keep your blood pressure below 120/80. Keep your cholesterol and blood sugar under control. And visit your primary care physician regularly. And the American Heart Association has publicized the Start Living Healthy brochure that gives tips on knowing your numbers for your cholesterol, blood pressure, waistline height and weight, and also how to get active and understanding what your family history is, as well as portion sizes and smart ways for cooking. And then here's a brochure put out by Boston Scientific that's a patient information guide that gives good information about the tests and procedures and ways of reducing your risk of coronary artery disease. Thank you.